If your hair feels thinner, sheds more than it used to, or just won't grow past a certain length, there are reasons why, and it's more common than you think. It can happen due to stress, hormonal changes, postpartum shifts, and/or aging. Today, I'm sharing dermatologist-approved secrets to grow longer, thicker, healthier hair, starting with the scalp, because that's where hair health actually begins. Hi, I'm Dr. Mamina Torregano. I'm a board-certified dermatologist, and I've treated literally thousands of patients with hair loss and also have personally dealt with hair loss, so it's a topic I am very passionate about. Hair thinning usually isn't caused by just one thing. Common contributors include hormonal changes, stress and illness. I'm talking like big life changes like surgery, death of a loved one, or childbirth. There's also nutrient deficiencies, and genetics can play a huge role. Just look at your mom or dad's scalp. Certain medications can definitely accelerate hair loss, and you also want to pay attention to scalp inflammation. That's why a one product solution rarely works. Healthy hair starts with a healthy scalp. Scalp inflammation shortens the hair growth phase and can increase hair shedding. Supporting the scalp can dramatically improve hair quality over time. If you have dandruff, please use an anti-dandruff shampoo with ingredients like ketoconazole and/or zinc. I find that these ingredients are helpful even if you aren't dealing with dandruff. Other ingredients I look for include anti-inflammatory and growth supportive compounds. One example is the Obagi Biostim Scalp Serum, which supports scalp health and follicle function with ingredients like amino acids, caffeine, panthenol, niacinamide, ginseng, pumpkin seed. These all can really help nourish the skin barrier in the scalp and reduce inflammation. Red light therapy on the scalp and gentle scalp massage can also improve circulation and follicle signaling. To grow longer, thicker hair, you want to keep your hair in the growth phase for as long as you can. So the most studied ingredient for this is topical minoxidil, commonly known as Rogaine. It helps extend the anagen or growth phase of the hair cycle. This doesn't mean lifelong commitment for everyone, but it's one of the most effective tools that we do have over the counter. Hair length also depends on breakage. So to protect your hair, you want to use heat protectants, you want to minimize high heat styling, use nourishing oils, and be gentle with brushing. Healthy hair growth means preventing damage, not just stimulating new growth. Now, for some people, prescription treatments are necessary, and that's okay. Depending on the cause, options may include oral minoxidil, oral spironolactone, or oral finasteride or dutasteride. These are prescribed based on your individual patterns and do require medical supervision. There are also prescriptions for dandruff or seborrheic dermatitis if you are not able to address those with over-the-counter options. Now, supplements can also support hair health, but they don't override the underlying issues. Options I often discuss include Viviscal Pro, Nutrafol, which both contain hydrolyzed marine collagen. There's also Biosil, Beauty Core, as well as pumpkin seed oil. I do a deep dive on hair supplements in this video here, so be sure to check it out. And when it comes to supplements, consistency does matter. Results take time, and supplements do work best if you have a discussion with your dermatologist about them to make sure that you're on the right one. Because you may need your blood work done first to know if you should be taking certain supplements or not. And then speaking of blood work, please don't miss the root cause of your hair loss. If hair loss is persistent, or it's showing more extensively on your scalp, you want to look deeper. So common underlying contributors include things like low iron, thyroid dysfunction, low vitamin D, certain autoimmune conditions, certain effects from medications, including GLP-1 medicines, which are very common, and dealing with infections or stress. Treating the cause will definitely lead to better outcomes. Now, here's what you can expect for a timeline for your results. Reduced shedding can happen in a few months. Visible regrowth can happen in about 4 to 6 months. It can be longer in some people, so please be patient. And best results occur with long-term consistency. Hair health is a long game, but it's a very treatable one. I know that the hair journey can be a stressful one, but remember to take a deep breath and stick with a solid routine like what I mentioned above. I share a lot about skin, hair, and longevity from a dermatologist perspective, and let me know if you want a full postpartum hair loss breakdown next. See you next time.